Are you getting all the nutrients your body craves? What if I told you that you might be missing out on some vital health guardians without even knowing it? Today, we're diving into the world of vitamins, those incredible molecules that can make or break your health. But how much do you really need, and where can you find them naturally? Stay tuned as we uncover the daily doses, natural sources, and the sneaky signs that your body is craving more. Get ready to transform your health knowledge and diet with our Vitamin Masterclass. Vitamins are organic compounds that are crucial for the proper functioning of our bodies. They are essential for growth, vitality, and well-being. Unlike macronutrients such as carbohydrates, proteins, and fats, which are required in large amounts, vitamins are needed in smaller quantities. However, their impact on our health is significant. Each vitamin plays a unique role in maintaining bodily functions. For instance, vitamin A is vital for vision and immune function, vitamin B complex helps in energy production and the formation of red blood cells, vitamin C is essential for the synthesis of collagen and acts as an antioxidant, and vitamin D regulates calcium and phosphate balance, crucial for bone health. The absence or insufficiency of these vital nutrients can lead to a range of health issues. Vitamin deficiencies can manifest in various ways, from fatigue and weakness to more severe conditions like scurvy, rickets, or beriberi, depending on which vitamin is lacking. To prevent such deficiencies, the concept of recommended dietary allowance, RDA, was introduced. The RDA represents the average daily dietary intake level sufficient to meet the nutrient requirements of nearly all 97–98% healthy individuals in a particular life stage and gender group. It is a guideline that helps individuals understand how much of each vitamin they should consume to maintain optimal health. Vitamin A, the essential nutrient for vision, immunity, and overall health. Vitamin A is a group of fat-soluble compounds that play an essential role in human health. It is crucial for maintaining good vision, ensuring the proper functioning of the immune system, and aiding in cell growth. This vitamin comes in two forms: preformed vitamin A, retinol, and retinol esters, found in animal products, and provitamin A, carotenoids, found in plant-based foods. The importance of vitamin A. Vitamin A is vital for various bodily functions. It helps form and maintain healthy skin, teeth, skeletal and soft tissue, and mucous membranes. It is also known as retinol because it produces the pigments in the retina, the light-sensitive layer of tissue at the back of the inner eye. Vitamin A promotes good vision, especially in low light, and may be required for reproduction and breastfeeding. Daily dose and recommended intake. The recommended dietary allowance, RDA, for vitamin A varies depending on age, gender, and life stage. Adult men require about 900 micrograms, mcg, of retinol activity equivalents, RAE, per day, while adult women need approximately 700 mcg/RA. It is important to note that pregnant and breastfeeding women have different requirements and should consult healthcare providers for their specific needs. Sources of vitamin A. Vitamin A can be sourced from a rich variety of foods. Animal-based sources of preformed vitamin A include liver and fish oils, milk and dairy products, eggs. Plant-based sources rich in provitamin, carotenoids include carrots and sweet potatoes, spinach and kale, apricots, mangoes, and papayas. Deficiency signs and health risks. Deficiency in vitamin A can lead to a range of health issues. Early signs of deficiency include night blindness and keratomalacia, an eye disorder that results in a dry cornea. In children, a lack of vitamin A can lead to severe visual impairment and blindness, increased risk of disease and death from severe infections, and slowed bone growth. Toxicity and overconsumption. While deficiency in vitamin A can have severe consequences, overconsumption can also be harmful. Hypervitaminosis A, caused by consuming too much preformed vitamin A, can lead to nausea, jaundice, irritability, anorexia, vomiting, blurry vision, headaches, muscle and abdominal pain and weakness, drowsiness, and altered mental status. In chronic cases, hair loss, dry skin, cracking of the lips, fever, insomnia, fatigue, weight loss, bone fractures, anemia, and diarrhea can occur. Vitamin A and immune function. Vitamin A is essential for the immune system. It plays a role in the development and differentiation of white blood cells, such as lymphocytes, which play critical roles in the immune response. A deficiency in vitamin A can lead to an impaired ability to fight infections. Vitamin A and vision. One of the most well-known functions of vitamin A is its role in vision and eye health. It is a component of rhodopsin, a protein in the eyes that allows you to see in low-light conditions. Without adequate vitamin A, one cannot see well in the dark, leading to a condition known as night blindness. Vitamin A and skin health. Vitamin A is also important for skin health. It helps to maintain the integrity and function of skin cells, making it an essential nutrient for combating acne and other skin conditions. It also has wound-healing properties and contributes to the skin's immune system. Conclusion: Vitamin A is a vital nutrient that should not be overlooked. A balanced diet that includes a variety of foods rich in vitamin A is essential for maintaining good health. However, it is important to be mindful of the recommended daily intake to avoid the risks associated with both deficiency and excess intake. Always consult with a healthcare provider before starting any new supplement regimen, especially if you have pre-existing health conditions or are pregnant or breastfeeding. This part of video provides a comprehensive overview of vitamin A, including its benefits, sources, daily recommended intake, signs of deficiency, and the risks of overconsumption. It emphasizes the importance of maintaining a balanced diet to ensure adequate intake of this essential nutrient for optimal health. Let's talk about vitamin B complex. First in it is vitamin B1, also known as thiamine. It is a water-soluble vitamin that is essential for the proper functioning of the body. It plays a critical role in energy metabolism by helping to convert nutrients into energy, particularly carbohydrates into glucose, which the body uses for fuel. Thiamine is also involved in nerve function and the synthesis of molecules that regulate the flow of electrolytes in and out of nerve and muscle cells. The recommended daily amount of thiamine for adult males is 1.2 milligrams, mg, and for adult females is 1.1 mg. Pregnant and breastfeeding women may require higher doses. It's important to consult with a healthcare provider for specific recommendations during these life stages. Sources of thiamine. Thiamine is found in a variety of foods, ensuring that people with diverse diets can obtain this essential nutrient. Some of the best sources of thiamine include whole grains and fortified cereals, pork and beef liver eggs, nuts and seeds, legumes like peas and beans, oranges and orange juice. Thiamine deficiency can lead to several health problems, collectively known as beriberi, which affects the cardiovascular, nervous, muscular, and gastrointestinal systems. There are two main types of beriberi. Wet beriberi affects the cardiovascular system, leading to heart failure and edema. Dry beriberi affects the nervous system, leading to muscle weakness and eventually muscle wasting. A severe form of thiamine deficiency is known as Wernicke-Korsakoff syndrome, which is most commonly seen in people with chronic alcoholism. This condition is characterized by severe neurological symptoms, including confusion, ataxia, and eye movement disturbances, and can be life-threatening if not treated promptly. Thiamine deficiency can also manifest as mild symptoms, which may include fatigue, irritability, poor concentration, and sleep disturbances. These symptoms are often vague and can be mistaken for other health issues, making it important to consider dietary intake when evaluating these signs. To prevent thiamine deficiency, it is essential to consume a balanced diet that includes thiamine-rich foods. In some cases, such as in individuals with alcohol dependence or certain medical conditions that affect nutrient absorption, thiamine supplements may be necessary. However, supplementation should always be done under the guidance of a healthcare professional to avoid potential interactions with other medications and to ensure proper dosage. In conclusion, thiamine is a vital nutrient that supports various bodily functions, especially energy metabolism and nerve function. A balanced diet typically provides sufficient thiamine, but certain populations may be at risk of deficiency and require supplementation. Recognizing the signs of thiamine deficiency is crucial for timely intervention and treatment. As with all nutrients, maintaining an appropriate balance is key to supporting overall health and well-being. Next is vitamin B2, also known as riboflavin. It is a water-soluble vitamin that is integral to various cellular processes, including energy production, cellular function, and the metabolism of fats, drugs, and steroids. It is a component of two major coenzymes, flavin mononucleotide, FMN, and flavin adenine dinucleotide, FAD, which are vital for these processes. Daily dose, the recommended dietary allowance, RDA, for riboflavin for adults is 1.3 mg for men and 1.1 mg for women. During pregnancy and lactation, the RDA increases to 1.4 mg and 1.6 mg daily, respectively. Sources: riboflavin is found in a variety of foods, ensuring that people can meet their daily requirements through diet. Key sources include dairy products like milk and yogurt, eggs, lean meats and organ meats, such as beef liver, green vegetables like spinach, nuts and seeds, fortified cereals and bread. Deficiency signs: a deficiency in riboflavin can lead to various health issues, including cracked lips, sore throat, swelling of the mouth and throat, swollen tongue, glossitis, hair loss, skin rash, anemia, itchy red eyes, cataracts in severe cases. Riboflavin deficiency is rare in the United States, but certain groups may be at higher risk, such as vegans or vegetarians who exclude dairy and meat products, and pregnant women with increased nutrient needs. To maintain adequate levels of riboflavin, it's essential to consume a balanced diet that includes riboflavin-rich foods. Supplements may be necessary for individuals with specific health conditions or dietary restrictions, but it's important to consult a healthcare provider before starting any supplementation. Third vitamin B is vitamin B3, also known as niacin. It is a water-soluble vitamin that is vital for the body's metabolism and overall health. It helps convert food into energy and plays a key role in maintaining healthy skin, nerves, and digestion. Daily dose. The recommended daily allowance, RDA, for niacin is 16 mg mg per day for adult men and 14 mg per day for adult women. Pregnant or nursing individuals may require about 18 mg per day. Sources: niacin is found in a variety of foods, ensuring that people can meet their daily requirements through diet. Some rich sources include red meat, fish, and poultry, fortified breads and cereals, enriched pasta and peanuts. Deficiency signs: a deficiency in niacin can lead to pellagra, characterized by the 4 Ds: dermatitis, diarrhea, dementia, and if untreated, death. Symptoms may include skin irritation and rash, bright red tongue, fatigue, apathy, and depression, headaches, memory loss, and hallucinations in severe cases. To prevent niacin deficiency, it's important to consume a balanced diet with adequate sources of vitamin B3. Supplements may be necessary for individuals with certain health conditions or dietary restrictions, but should be taken under medical supervision to avoid the risk of toxicity. Next is vitamin B5, also known as pantothenic acid. It is a water-soluble vitamin that is essential for human life. It's necessary for making blood cells, and it helps you convert the food you eat into energy. Daily dose. The recommended dietary allowance, RDA, for adults is 5 mg daily. This amount increases to 6 mg during pregnancy and 7 mg for breastfeeding women 123. Sources: vitamin B5 is widely available in both plant and animal foods, so deficiency is rare. Some of the best sources include beef, chicken, and organ meats, mushrooms and avocados, nuts, seeds, and dairy products, potatoes, eggs, and whole grains like brown rice and oats. Deficiency signs. While deficiency is uncommon, it can cause symptoms like fatigue and irritability, sleep disturbances, stomach pains, numbness and muscle cramps, hypoglycemia, and increased sensitivity to insulin. Because pantothenic acid is involved in a wide array of biological functions, from synthesizing coenzyme A to breaking down fats, a balanced intake is crucial for maintaining good health and energy levels. Always consult with a healthcare provider before starting any new supplement regimen. Next, an important vitamin B is vitamin B6, also known as pyridoxine. It is a water-soluble vitamin that is part of the B-complex vitamins. It plays a significant role in protein metabolism, cognitive development, and the production of neurotransmitters and hemoglobin. Daily dose. The recommended daily intake of vitamin B6 for adults is 1.3 mg mg for individuals aged 19 to 50. For men over 50, the daily intake increases to 1.7 mg, and for women over 50, it is 1.5 ml. Pregnant and lactating women have higher requirements, with recommended intakes of 1.9 mg and 2.0 mg respectively. Sources: vitamin B6 can be found in a wide range of foods, which makes it accessible through a balanced diet. Some rich sources include poultry, such as chicken or turkey, fish, particularly salmon and tuna, fortified cereals, chickpeas, bananas, potatoes, and other starchy vegetables, non-citrus fruits. Deficiency signs. Although vitamin B6 deficiency is rare, it can occur and lead to health issues. Some signs of deficiency include skin rashes, cracked and sore lips, sore, glossy tongue, mood changes, weakened immune function, tiredness and low energy, tingling and pain in hands and feet. In severe cases, a deficiency can lead to anemia and seizures. Groups at risk of vitamin B6 inadequacy include the elderly, those with autoimmune disorders, and individuals with impaired renal function or malabsorption syndromes. Maintaining adequate levels of vitamin B6 is important for overall health, particularly for metabolic processes and immune function. A balanced diet typically provides sufficient amounts of this vitamin, but supplements are available for those who may need them. It's always best to consult with a healthcare provider before starting any new supplement to ensure it's necessary and to determine the appropriate dosage. Next is vitamin B7, commonly known as biotin. It is part of the B-complex vitamins. It's crucial for metabolizing fats, carbohydrates, and proteins. Daily dose. Adults should aim for 30 micrograms mcg per day, while lactating women need 35 mcg. Sources: rich sources include red meat, eggs, seeds, nuts. Deficiency signs. Deficiency may lead to skin rashes, hair loss, fatigue, neurological issues. A balanced diet typically provides sufficient biotin, and deficiency is rare. One of the most important vitamin B complex is vitamin B9, commonly known as folate. It is found in foods, and folic acid, when used in dietary supplements and fortified foods, is a water-soluble B vitamin that is essential for human health. It plays a significant role in DNA synthesis and repair, encourages cell and tissue growth, and is critical during periods of rapid growth, such as pregnancy and fetal development. Daily dose. The recommended daily amount of folate for adults is 400 micrograms mcg1. For pregnant women, the recommendation increases to 600 mcg to support fetal development and reduce the risk of neural tube defects. The tolerable upper intake level, UL, for adults is set at 1000 mcg. Sources. Folate is naturally present in a wide range of foods, and folic acid is added to many fortified foods. Some excellent sources of folate include leafy green vegetables such as spinach and kale, fruits and fruit juices, especially oranges and orange juice nuts, beans and peas, poultry, pork, and shellfish. Whole grains and fortified cereals, liver and other organ meats. Deficiency signs. A deficiency in folate can lead to several health issues, including megaloblastic anemia, characterized by large, immature red blood cells, weakness, fatigue and difficulty concentrating, heart palpitations, shortness of breath, open sores on the tongue and inside the mouth, changes in skin, hair, or fingernail color. Folate deficiency during pregnancy can lead to serious birth defects of the brain and spine, known as neural tube defects. Therefore, it's particularly important for women of childbearing age to consume enough folate. To ensure adequate intake of vitamin B9, it's important to include folate-rich foods in your diet or consider a supplement if you're at risk of deficiency. This is especially crucial for pregnant women, individuals with malabsorption issues, and those on certain medications that may interfere with folate absorption. As always, it's best to consult with a healthcare provider before starting any new supplement regimen to ensure it's appropriate for your individual health needs and circumstances. Most important B complex is vitamin B12, also known as cobalamine. It is a crucial water-soluble vitamin that is essential for the normal functioning of the brain and nervous system, the formation of blood, and the creation of DNA. It contains the mineral cobalt and is the only vitamin that has a metal ion. Daily dose. The recommended daily intake of vitamin B12 for adults is 2.4 micrograms mcg1. Pregnant women should aim for 2.6 mcg, and breastfeeding women should increase their intake to 2.8 mcg per day too. It's important to note that vitamin B12 is stored in the liver, so deficiency symptoms may take a while to manifest. Sources. Vitamin B12 is naturally found in animal products and is not generally present in plant foods. Key sources include meat and poultry, fish and shellfish, dairy products, eggs, fortified cereals, and plant-based milk. For those on a vegan diet or with certain medical conditions that affect absorption, vitamin B12 supplements or fortified foods are an important part of the diet to ensure adequate intake. Deficiency signs. Vitamin B12 deficiency can lead to several health issues, including megaloblastic anemia, which presents with symptoms like fatigue, weakness, constipation, loss of appetite, and weight loss. Neurological changes, such as numbness and tingling in the hands and feet, may also occur. Other symptoms include difficulty maintaining balance, depression, confusion, dementia, poor memory, and soreness of the mouth or tongue. The risk of vitamin B12 deficiency is higher in older adults, individuals with pernicious anemia, and those with gastrointestinal disorders such as Crohn's disease or celiac disease, which affect the absorption of nutrients. Long-term use of certain medications, like proton pump inhibitors and metformin, can also lead to a deficiency. To prevent vitamin B12 deficiency, it's crucial to consume a diet that includes sufficient amounts of the vitamin, particularly for populations at risk of inadequate intake. Regular monitoring and supplementation may be necessary for some individuals to maintain optimal health. Always consult with a healthcare provider before starting any new supplement regimen, especially if you have pre-existing health conditions or dietary restrictions. Vitamin B12 is a K nutrient that supports overall health and well-being, and adequate intake is necessary for maintaining energy levels, cognitive function, and a healthy nervous system. Next is vitamin C, also known as ascorbic acid. It is a vital nutrient that serves several important roles in maintaining your health. It is an antioxidant that helps protect your cells against the effects of free radicals, molecules produced when your body breaks down food or is exposed to tobacco smoke and radiation from the sun, X-rays, or other sources. Free radicals might play a role in heart disease, cancer, and other diseases. The recommended daily amount for vitamin C is 75 mg/mg for adult women and 90 mg for adult men. During pregnancy, women should aim for 120 mg a day. The upper limit for all adults, which should not be exceeded, is 2,000 mg a day. Vitamin C is found in various foods, especially fruits and vegetables. Some of the best sources of vitamin C include citrus fruits like oranges and grapefruits, berries such as strawberries, raspberries, blueberries, and cranberries, watermelon and cantaloupe, kiwi, fruit mango, pineapple, papaya, and guava. Vegetables such as broccoli, Brussels sprouts, cauliflower, green and red peppers, spinach, cabbage, turnip greens, and other leafy greens. Tomatoes and tomato juice. Potatoes deficiency signs. Vitamin C deficiency can lead to scurvy, which can cause symptoms such as fatigue, muscle weakness, joint and muscle aches, a rash on the legs, bruising, bleeding gums and loose teeth, dry hair and skin, anemia, decreased ability to fight infection and heal wounds. In severe cases, scurvy can lead to heart problems and can be fatal if not treated. It's important to note that while deficiency is relatively rare in developed countries due to the availability of fresh produce, it still affects some populations, including those with poor diets, alcoholism, anorexia, severe mental illness, smoking, and those undergoing dialysis. To maintain adequate levels of vitamin C, it's essential to consume a balanced diet that includes a variety of fruits and vegetables. Supplements may be necessary for individuals with specific health conditions or dietary restrictions, but it's important to consult a healthcare provider before starting any supplementation. Vitamin C is also important for the health of your bones, teeth, and the soft tissue under your skin. It helps your body absorb iron from plant-based foods and supports the immune system's ability to fight off bacteria and viruses. Moreover, vitamin C is involved in the production of collagen, which is necessary for wound healing. Given its role in collagen production, vitamin C is also important for healthy skin. A deficiency in vitamin C can lead to rough, bumpy skin and corkscrew-shaped body hair due to defects that develop in the protein structure of hair as it grows. Hair abnormalities often resolve within 1 month of treatment with adequate amounts of vitamin C. Another sign of vitamin C deficiency is bright red hair follicles. Hair follicles on the surface of the skin contain many tiny blood vessels that supply blood and nutrients to the area. When the body is deficient in vitamin C, these small blood vessels become fragile and break easily, causing small, bright red spots to appear around the hair follicles. This is known as perifollicular hemorrhage and is a well-documented sign of severe vitamin C deficiency. Taking vitamin C supplements typically resolves this symptom within 2 weeks. Next, and most trending vitamin, is vitamin D, often nicknamed the sunshine vitamin. It is a unique nutrient that is essential for several critical bodily functions. It is not only a vitamin, but also a hormone produced by the body, when the skin is exposed to sunlight. Its roles in the body are multifaceted and vital for maintaining good health. The recommended daily intake of vitamin D is not one size fits all. It varies based on age, skin color, geographic location, and sun exposure. Generally, the recommended daily amount for most adults is 600 international units, IU, which increases to 800 IU for those over 70 years old to help maintain bone health. However, some experts suggest higher daily intakes, especially for individuals at risk of deficiency, which can be as high as 1,500 to 2,000 IU. While the body can produce vitamin D naturally when exposed to sunlight, many factors can affect this process, such as the use of sunscreen, clothing, time of day, skin pigmentation, and geographic location. Therefore, dietary sources are also important, especially for those with limited sun exposure. Dietary sources include fatty fish, like salmon, mackerel, and tuna, fish liver oils, egg yolks, beef liver, cheese, fortified foods, such as milk, orange juice, and cereals. Deficiency signs. Vitamin D deficiency can lead to a variety of health issues. In children, it can cause rickets, a disease characterized by bone deformities. In adults, deficiency can lead to osteomalacia, resulting in weak bones and muscle weakness, and contribute to osteoporosis, increasing the risk of fractures. Other signs of deficiency include fatigue, bone pain, muscle weakness, mood changes like depression, and an increased risk of infections. Vitamin D's role in the body extends beyond bone health. It is crucial for calcium absorption, which is necessary for maintaining strong bones and teeth. It also supports the immune system, brain health, and regulates inflammation. Adequate vitamin D may reduce the risk of multiple sclerosis, heart disease, and certain types of cancer. It is also believed to play a role in mood regulation and protecting against depression. Despite its importance, vitamin D deficiency is a global health issue affecting people of all ages. Factors contributing to deficiency include limited sun exposure, living in northern latitudes, having dark skin, being elderly, and certain medical conditions that affect absorption. Even breastfeeding infants can be at risk, as breast milk alone does not provide adequate vitamin D4. To combat deficiency, health professionals often recommend vitamin D supplements, especially for those at higher risk. However, it's important to avoid excessive intake, which can lead to toxicity and cause symptoms such as nausea, vomiting, weakness, and serious complications like kidney damage. The role of vitamin D in the immune system is particularly noteworthy. It is known to enhance the pathogen-fighting effects of monocytes and macrophages, white blood cells that are important parts of your immune defense, and decreases inflammation, which helps promote immune response. This is particularly important for the body's defense against respiratory illnesses and may explain why flu occurrences decrease during the summer and fall when people receive more sunlight exposure. Vitamin D also has a significant impact on mental health. Studies have found that low levels of vitamin D are associated with an increased risk of depression. Supplementation has shown promise in improving mood and alleviating symptoms of depression in individuals with clinically low levels of this vitamin. For weight management, vitamin D might have a role as well. People with higher body weights are more likely to have lower levels of vitamin D. Some studies suggest that vitamin D supplementation, in conjunction with a calorie-restricted diet, may aid in weight loss and fat reduction. Given the wide array of health benefits associated with vitamin D, ensuring adequate intake is crucial. This can be achieved through a combination of sunlight exposure, diet, and supplementation when necessary. It's important to consult with a healthcare provider to determine the appropriate amount of vitamin D for individual needs, especially for those with pre-existing health conditions or those who are pregnant or breastfeeding. Next is vitamin E, a fat-soluble nutrient found in many foods. It acts as an antioxidant, helping to protect cells from the damage caused by free radicals. It's also vital for immune function, cell signaling, regulation of gene expression, and other metabolic processes. The recommended daily allowance, RDA, for vitamin E varies with age and other factors. For adults and children over 14 years, the RDA is 15 milligrams, mg, of vitamin E per day. For toddlers age 1 to 3, it is 6 milligrams a day. For kids age 4 to 8, it is 7 milligrams a day. And for adolescent ages 9 to 13 years, it is 11 milligrams a day. Women who are breastfeeding should aim for 19 milligrams per day. Vitamin E is found in a variety of foods, making it accessible through a balanced diet. Some rich sources include nuts and seeds, such as almonds and sunflower seeds, vegetable oils, particularly olive and sunflower oil, green leafy vegetables like spinach and broccoli, fortified cereals, eggs, kiwi, and mango. Combining just a few of these foods can help meet your daily vitamin E intake. For example, 1 ounce of sunflower seeds contains 7.4 milligrams of vitamin E, and 2 tablespoons of peanut butter contain 2.9 milligrams. Vitamin E deficiency is rare and usually linked to diseases where fat is not properly digested or absorbed, such as Crohn's disease or cystic fibrosis. Symptoms of deficiency can include muscle weakness and coordination difficulties, nerve pain or neuropathy, visual disturbances, immune system problems. High doses of vitamin E can increase the risk of bleeding, and it's important to consult a doctor if you begin experiencing any symptoms of deficiency. Vitamin E's role as an antioxidant is particularly significant. It helps combat oxidative stress, which is linked to the development of chronic diseases such as cancer and heart disease. By neutralizing free radicals, vitamin E helps protect the integrity of cell membranes and DNA. The vitamin also has benefits for skin health due to its antioxidant properties. It can help protect the skin from damage caused by ultraviolet light, pollution, and other environmental factors that can lead to signs of aging. Vitamin E is also involved in immune function and helps the body fight off invading bacteria and viruses. For heart health, vitamin E's antioxidant properties may help prevent or delay the development of atherosclerosis, a condition characterized by the buildup of plaque in the arteries that can lead to heart attack or stroke. Some research suggests that vitamin E may help prevent or treat coronary artery disease and may be beneficial for those at high risk of a heart attack. Despite its importance, it's crucial not to consume too much vitamin E, as high levels can lead to toxicity and adverse health effects. Symptoms of vitamin E toxicity include nausea, diarrhea, stomach cramps, fatigue, weakness, headache, blurred vision, rash, and bruising and bleeding more easily. The upper limit for vitamin E is 1,000 milligrams or 1,500 IU for adults. Last but not the least is vitamin K. It is a group of structurally similar fat-soluble vitamins that the human body requires for complete synthesis of certain proteins that are prerequisites for blood coagulation, and which the body also needs for controlling binding of calcium in bones and other tissues. The vitamin K-related modification of the proteins allows them to bind calcium ions, which they cannot do otherwise. Without vitamin K, blood coagulation is seriously impaired and uncontrolled bleeding occurs. Low levels of vitamin K can also affect the health of bones and other tissues. The recommended adequate intake of vitamin K varies by age and gender. For adult women, it's 90 micrograms mcg per day, and for adult men, it's 120 mcg per day. For children, the intake ranges from 2 mcg for infants to 60 mcg for those aged 9 to 13 years. Pregnant or breastfeeding women, especially those under 19 years of age, should aim for 75 mcg per day. Vitamin K can be found in a variety of foods, ensuring that people can meet their daily requirements through diet. Some excellent sources of vitamin K include leafy green vegetables like spinach, kale, and collard greens. Vegetables such as broccoli, Brussels sprouts, and cabbage fish, liver, meat, eggs, and cereals contain smaller amounts. Deficiency signs. Vitamin K deficiency is rare in adults but can lead to excessive bleeding, which may manifest as easy bruising, bleeding gums, nosebleeds, and heavy menstrual periods in women. In severe cases, it can cause bleeding in the gastrointestinal tract and the brain, which can be life-threatening. Newborns are particularly at risk for vitamin K deficiency, which can lead to a condition known as vitamin K deficiency bleeding, VKDB. This is why newborns often receive a vitamin K injection to prevent potential bleeding issues. Vitamin K is not just a single compound, but a family of related compounds divided into two main groups: vitamin K1, phylloquinone, found in plant sources, especially green leafy vegetables; vitamin K2, menaquinones, found in animal sources and fermented foods, and also produced by gut bacteria. The role of vitamin K extends beyond blood clotting. It's also essential for bone metabolism. Adequate vitamin K is necessary for the proper functioning of osteocalcin, a protein that binds calcium and helps form and maintain strong bones. Additionally, vitamin K2 has been associated with cardiovascular health, as it may help prevent calcium from depositing in the arteries and blood vessels. While deficiency in adults is uncommon due to the presence of vitamin K in many foods and the body's ability to recycle it, certain conditions can increase the risk of deficiency. These include diseases that affect fat absorption, such as Crohn's disease and celiac disease, as well as the use of certain medications like antibiotics and anticoagulants that can interfere with vitamin K metabolism. To ensure adequate vitamin K intake, it's important to include a variety of vitamin K-rich foods in your diet. For individuals who may be at risk of deficiency, such as those with malabsorption issues or on long-term antibiotics, supplementation may be necessary under medical supervision. Here are some important tips to help ensure you get enough essential vitamins. Eat a balanced diet, consume a variety of foods to get a wide range of vitamins, include plenty of fruits, vegetables, lean proteins, whole grains, and healthy fats in your meals. Sunlight exposure. Spend time outdoors to help your body produce vitamin D. Aim for 10–30 minutes of midday sunlight several times a week, depending on your skin type and location. Consider fortified foods. If you have dietary restrictions or allergies, look for fortified foods that have vitamins added to them, such as certain cereals, plant-based milk, and juices. Supplements. If you're at risk of certain deficiencies, consider taking a supplement, but first consult with a healthcare provider to determine the right dosage and to avoid potential interactions with medications. Regular checkups. Have your blood work analyzed periodically to check for vitamin levels, especially if you have symptoms of a deficiency or if you're at risk due to lifestyle or health conditions. Healthy fats. Include sources of healthy fats in your diet, like avocados, nuts, seeds, and olive oil, to help absorb fat-soluble vitamins A, D, E, and K.1. Avoid overcooking. Overcooking can destroy some vitamins. Opt for cooking methods that preserve nutrient content, such as steaming or sautéing. Hydration. Stay hydrated, as water helps transport vitamins and minerals throughout the body. Limit. Processed foods. Processed foods often lack essential nutrients. Choose whole, minimally processed foods whenever possible. Mind your gut health. A healthy gut can improve the absorption of vitamins. Include probiotic-rich foods like yogurt and fermented foods in your diet. By following these tips, you can help prevent vitamin deficiencies and support your body's nutritional needs. Remember, a proactive approach to nutrition can contribute to a healthier, more energetic life.